Ancient Indian traditions describe telepathy as an advanced spiritual mastery. Today, that ambition is being executed as an $18 million DARPA contract. DARPA was created in 1958 specifically to prevent technological surprise. After the Soviet Union launched Sputnik, the United States military realized it needed an agency dedicated to engineering breakthroughs that were decades ahead of the curve. In Vietnam, this took the form of offset technology, tools that allowed soldiers to monitor a battlefield from a distance. DARPA developed 3-foot-long acoustic sensors that were dropped into the jungle to detect enemy movement and relay the data to overhead aircraft. This strategy eventually evolved into the unmanned drones used during the Gulf War. These systems removed the operator from the immediate line of fire, but they still relied on physical joysticks and screens. Tracking this historical trajectory suggests that the next logical limit for military control is the removal of the physical interface. The ultimate tactical advantage is a system where a human mind can communicate directly with a machine. The modern objective is a reality where a soldier can pilot drone swarms or transmit complex images to a squadmate using only their thoughts. Standing in the way is a massive physical barrier, the human skull. Bone is an exceptional insulator, designed to protect neural tissue, but it is equally effective at blocking the electrical signals engineers need to read. While brain-computer interfaces already exist, they typically require invasive surgery to implant electrodes. For a healthy military operator, drilling into the skull is a non-starter. Achieving direct communication requires a way to read and write neural activity through solid bone at the speed of thought. This is the mandate of the Moana project, a core part of DARPA's next-generation non-surgical neurotechnology program. The Moana project approaches telepathy as a two-way physics problem, reading data out of a sender's brain and writing it into a receiver's. The first step, reading, utilizes focused ultrasound. This allows engineers to safely deliver a genetic payload into the brain's visual cortex without any surgical incisions. This payload reprograms specific neurons to produce synthetic proteins. These proteins are designed to absorb light the moment a neuron fires an electrical impulse. The user then wears a cap that shoots infrared light through the skull. Because red and infrared wavelengths can penetrate bone, the light reaches the visual cortex and bounces back out, unless it is absorbed by those active modified neurons. Ultra-fast sensors in the cap catch the reflected light. By analyzing which photons were absorbed and which were reflected, a system called TOF-DOT creates a real-time 3D map of exactly which neural pathways are active. By tracking these optical changes, engineers can decode how the brain is processing an image, effectively reading human perception without ever touching the brain tissue. The second half of the loop is the transmission, writing that decoded image into a receiving brain. For the receiver, a second genetic payload tethers magnetic iron nanoparticles to the ion channels inside their neurons. When the system needs to transmit an image, it applies an external magnetic field to the receiver's skull. This field passes through the bone and heats the iron nanoparticles. That heat forces the ion channel to open. This triggers the neuron to fire, manually creating a visual perception in the receiver's mind that mimics real sight. For this to work as a conversation, the entire process must happen in under 50 milliseconds. This speed is critical for the receiver to experience the perception at the same time the sender thinks it. By using magnetic fields as a wireless trigger, engineers can bypass the skull's protection and manually implant visual data, effectively writing thoughts in real time. Having successfully tested these principles in cell cultures and animal models, the Moana team expects to begin human trials within the next 2 years. The primary medical goal is to restore sight. By transmitting images directly into the visual cortex, this hardware can bypass damaged eyes entirely, providing a non-surgical alternative for blind patients. Beyond medicine, the objective is to connect human minds directly to cloud-based AI. If data can flow seamlessly between the brain and the machine, physical interfaces like screens and keyboards become obsolete. This level of integration introduces deep ethical concerns. If a system can write images into a visual cortex, the regulation of cognitive privacy and the reality of telepathic warfare become immediate strategic challenges. The combination of optics, genetics, and electromagnetism has converted the human skull from a physical barrier into a data interface. Silent, direct communication is transitioning from a theoretical ambition into a hardware reality. It is simply a matter of time.